Hi, I'm Dr. Zaki, and I hope that I can be a dentist for today, if you allow me to be so. I was on Reddit a couple of days ago and I found a subreddit called Ask Dentists, where a lot of patients go, ask and leave their concerns and questions where dentists reply to them. So I thought, let's answer some questions. Side note, I have a pimple here that I hope the editor can remove. Medium Snacks is asking, teeth grinding or jaw clenching advice. I live in an apartment during the work week and in my family home during the weekend. The past 2 weeks of staying at my apartment, I have felt like my jaw hurts after I wake up and aches throughout the day. Any advice on what I can do to stop or help it during the quarantine? Dentist isn't open up until May or for emergencies only. I have a family history of teeth grinding and my mom has a mouth guard at night. Okay, so when it comes to teeth grinding or jaw clenching, this is kind of a common thing that happens due to stresses. And right now we're living through a stress that's going on, following the news. If you're following the news each and every hour, I would say watch just once a day, an hour a day, reduce this amount because the stresses are insane. If it's not the stress and it's something habitual, so you have a habit that you want to break, so this is the right time to break a habit because you have some time in your hands. Just like any other habit that you have, it just needs persistence and well-awareness that you have this habit and you try to control each and every time you catch yourself clenching. Of course, these are things that you can do right now in the comfort of your home until you can see your dentist and ask them to make you a night guard. I was wondering if you should brush your teeth 3 times a day to whiten it like it says on the toothpaste, or is that a marketing scam? Okay, Lily Meme, this is a very common question. Answer is usually that you need to do it after each meal. So the 3 times a day came from that, having 3 major meals a day, breakfast, lunch, and dinner. You brush your teeth after each and every one of them. If you have like mini snacks, then try if you can brush your teeth then. You don't have to have a toothpaste every single time. My wisdom teeth came in without a problem years ago, but began to crack and break a few years ago. I ignored it out of extreme fear from past bad dental work, but now they're causing me a lot of issues and I'm worried about my possibility of infection in the near future. It seems to me that now is a really bad time to get dental work done, but I know that there's never a good time for a dental infection. The question is, are tooth extractions okay right now or better left until the spread of virus is better controlled? Is the risk of infection greater from severely broken, painful wisdom tooth or from COVID-19 and dental work? This question is packed with information. First of all, this patient has fears and issues when it comes to dental visits, and this is a very common thing due to past trauma, past unpleasant visits that happened before. So these kind of patients require extra reassurance, and you need to follow up with them and be extra friendly and extra nice and try to break the fear between you and their dentist. So this is always a challenging thing to do, to have like a friendly common ground. I would tell this patient if it hurts you, it's causing you discomfort or pain, then go see your dentist. This falls under the essential treatments that we do right now during the corona outbreak. But if it's just you're anxious about any possible infections, then just talking to your dentist will give you some sort of reassurance that this is okay and will give you some oral hygiene measures that you can follow until this is gone. Then you can sort this out if it starts hurting later on. How bad is it to eat something after brushing your teeth, then go to bed without brushing again? I would tell Machine Gecko, congratulations, you've played yourself. Because eating after brushing your teeth basically makes it unclean again, so you will have to go brush it again. So you get what I'm saying? Does using hydrogen peroxide to whiten teeth actually works? If so, then how much is safe to use? How long should I use it for? How do I use it in the first place? Please, for the sake of everything that is nice, don't use hydrogen peroxide to bleach your teeth. If you want to bleach your teeth, go to your dentist, ask for an in-office bleaching, or if you want to do it at home, then go to your dentist as well. They will make you a tray that looks like the Invisalign invisible braces. Then they will provide you with a gel that you can apply at home, which is safe and it has a certain way to use it. You know what to do with your hydrogen peroxide though? You can use it to remove the earwax inside your ears. So make sure you have a dropper, take a couple of drops, put it inside your ear canal. That will make the earwax just flow outside of your ears without using Q-tips, because Q-tips, it has been proven that it transmits a lot of infection inside your ears and you don't want that. So that's your tip for today. Lines on teeth. freaking out in general. Great. A blinding blizzard is freaking out. So as a kid, I never took good care of my teeth, and I pay for it somewhat now, but am trying to recover. I'm starting to get those brownish lines on my bottom teeth, horizontal near the gums. I'm constantly stressing over it and my oral health in general. Can someone tell me if my teeth are doomed or if I can relax? Also, how do gums look in general other than the one damaged area? I can post more pictures if needed, but I've been worrying constantly, and this patient provides a picture, and the picture is all right. It's not, disgusting. Don't worry about it. So these brown lines that we're seeing right now is called tartar or dental calculus. This happens when there's calcifications on your teeth because lack of oral hygiene, not brushing your teeth, flossing well, going through regular scheduled dental appointments every 6 months or even less. The treatment for this is just going to a dental hygienist or dentist, and they will clean your teeth, and it's going to be fine. And Blinding Blizzard is also asking, how do gums look in general other than the one damaged area? It should look normally homogeneous with your teeth. At the same time, it shouldn't be red. Red is a sign of blood, inflammation. That's why when you have inflammation, you brush your teeth, blood comes out. So it should be pink, because on Wednesdays we wear pink, and your gums wear pink all the time. This was bad. I'll editor, please remove it. Filling fell out and they won't see me anywhere. Is this a problem? What should I do in the meantime? How long can I leave it like this? It hurts when I eat or drink anything that is not a lukewarm. Since this hurts, this falls under the essential treatment line. You should get it checked right away. Don't worry about it. You should get it checked. If it's not something that is not hurting, it's something, an optional thing that you can wait on, then you should wait on it. But right now this is hurting you, so get it checked and it will be fine. All dentists closed due to COVID and need an opinion. So I've got a chipped tooth right now, horror timing, LOL, but it's still wedged in between my teeth. Can I use quick dry, clear nail polish or super glue to temporarily keep it from falling out until I see a dentist in a week or so time? I know it's stupid and it's not something I want to try or do, but I'd rather not have a part of my tooth missing altogether. Well, I'm glad we agree on something, that this is something stupid. First of all, never use super glue or dry clean nail polish on your teeth, because there's something when it comes to materials we use in dentistry and in any part in medicine, any implant we put, it has to go through certain regulations. One of those regulations should be biocompatible. What biocompatible means is that your body accepts the material. It doesn't attack it, it doesn't reject or refuse it, and cause eventually harm. Those two things, I don't know, what it's made of, but I'm 100% sure it contains a lot of toxins that shouldn't be near your body, or inside your body to be exact. Charcoal toothpaste, yes or no? Charcoal in cosmetics. This is something that we need to talk about first. I just looked up an interesting stat that claims that the global market of charcoal, activated charcoal to be exact, is going to reach $6.2 billion by the end of 2022. That's of course if we make it. So we've seen it being used when it comes to other cosmetic things on skins and stuff. So let's talk about the teeth and the things I know right now. Let's look at the facts. Fact number one is that this is a very new material being used. Research being done on it hasn't been there for quite some time to say that this is actually healthy and beneficial on the long term. Is it safe to use, to recommend, or not? So we need to keep that in mind. Fact number two is that this is an abrasive material, and we've seen multiple materials in the dental world where they say this will brighten or whiten your teeth while it's abrasive. What does abrasive mean? It means that it wears away the outer surface of your tooth, exposing the layer under, which is whiter, less stained, so it appears to be white, which is great, but at the same time you're taking away your tooth structure. If you keep doing that over and over, you're gonna have a thin tooth, and then you'll need treatment because of how sensitive it's gonna be. Fact number three, it being abrasive will also cause gum damage. Because it's abrasive, imagine a sandpaper being rubbed against tissue, which is gonna cause inflammation, bleeding, and things that we don't want to have in your mouth. With these facts in hand, I would very hardly recommend this material to be used. Don't use charcoal in your teeth. We have very little information when it comes to it. We cannot guarantee if this is a good thing or not, but what we do know, it's abrasive, and we have seen already abrasive materials being used to brighten and whiten teeth. What I would say, don't do it. I'll keep an eye on it because there's going to be constant research being done. If there's something that is new to this, I'll keep you updated with it. But right now, don't fall for it. And I've already seen tons. If you just write charcoal toothpaste or charcoal brushes on Instagram, you're going to find a lot of influencers recommending and telling you do this. It's brightening their teeth. This is part of their morning routine, part of their daily life. That's what they use when they go to parties. I would say don't fall for this. Just exactly the same way when you receive posts from influencers telling you essential oils is what boosts the immune system and essential oils are the way to life. Thought twist, essential oils are crap. What are the signs of wisdom teeth beginning to emerge? Well, there are multiple of them, multiple reasons. One of them is pain. You're gonna start feeling pain, maybe radiating to your jaw, an inflamed gum, maybe a little bleeding. Can I live with a gap from an extracted tooth? A few years ago, maybe 2-3-ish, I don't recall, I had a cavity that went bad and required a root canal, but I wasn't able to afford it at the time, so I opted to have it extracted. This is very common. This would be tooth number 19, which is lower left 6. I went in for a cleaning today, and the dentist mentioned to come back when I'm ready for a dental implant. I asked if it was absolutely necessary. He mentioned that the top tooth might grow down into the empty space, the 2 adjacent teeth might move to fill the gap. My question is, can I live without getting the implant, which is $3,000? Fast answer is you can live without it, but your dentist is correct. When there is a space between 2 molars or 2 teeth, those 2 teeth try as much as they can to lean over, closing the gap, and the one opposing at the other side, either the lower or the upper, will try to close in as well. Are implants the only solution out there? No, it's not. You can do a bridge depending on the conditions of the front and back teeth. It depends on all different things that I can't see right now because there's no pictures provided, but implants are very reliable. Once you put it, if it's done correctly, you can live with it throughout your whole life. Removable prostheses are also there. You can do that. So it's not just the 3,000 option that is there. Ask for more treatment options. You can find different price ranges that suits you. And I'm done with the questions for this video. If you enjoyed this kind of format and you want to see more questions answered, please make sure to like and subscribe and do the YouTube things so that they can know that I exist. If you want to watch something dentistry related, this is a video made for you of me reacting to dental memes, learning a thing or two while laughing. And if you want to watch something not dentistry related, this is made just for you. I hope you enjoyed them, and let me see you in the next video.